Are you one of those people who diligently pops a pill each morning but isn't sure about the do's and don'ts when it comes to taking medication in an empty stomach? Don't worry, you're not alone. Understanding the nuances of medication absorption can be confusing, especially when it comes to timing your doses with your meals. But fear not, because in this guide, we'll break down the top 10 medications that you should take on an empty stomach and why it matters. Number 1. Thyroid medications. Dealing with hypothyroidism often means relying on medications like levothyroxine. These drugs perform optimally when taken on an empty stomach roughly 30 to 60 minutes before breakfast. But why the empty stomach requirement? Well, certain foods and drinks such as coffee and high-fiber foods can throw a wrench into their absorption process. This interference can significantly impact their effectiveness in regulating your thyroid levels. So for the best results, it's wise to adhere to an empty stomach recommendation and give your medication the chance to work its magic without any dietary distractions. Number 2. Bisphosphonates. If you're combating osteoporosis with medications like alendronate and ivandronate, timing is crucial. These drugs should be taken at least 3 minutes before your first meal, drink, or medication of the day. Avoiding orange juice is especially important, as it can significantly decrease their absorption. Number 3. Sucralfate. Used to treat intestinal ulcers, sucralfate requires an empty stomach for optimal effectiveness. Take it at least 1 hour before or 2 hours after a meal to ensure proper coating of the ulcer. Also avoid pairing it with antacids as they can interfere with its actions. Number 4. Sildenafil or Viagra. Let's chat about the timing of this little blue pill. If you're tackling erectile dysfunction with sildenafil, here's the scoop. Taking it on an empty stomach is your best bet for quick results. Sure, you can take it with or without food, but if you're hoping for speedy magic, steer clear of high-fat meals. Why? Because they can slow down how fast sildenafil kicks in, and nobody wants to wait longer than necessary for that boost. So it's time for your dose. Think light and lead for the best chance at getting the most out of your sildenafil experience. Number 5. Captopril. If you're grappling with high blood pressure or heart failure and relying on Captopril for management, timing is key. Consuming it with food can hamper its absorption, diminishing its effectiveness. To ensure you're getting the most of your medication, aim to take Captopril either 1 hour before or 2 hours after meals. This simple adjustment can make a significant difference in how well your medication works to regulate your blood pressure or manage your heart condition. Number 6. Bethanical. This medication treats urinary retention and should be taken on an empty stomach to avoid nausea and vomiting. Aim for 1 hour before or 2 hours after meals and consider setting an alarm to stay on schedule, given its multiple daily doses. Number 7. Ampicillin. When it comes to antibiotics like ampicillin, timing can impact their effectiveness against infections. Taking it on an empty stomach at least 30 minutes before or 2 hours after meals ensures optimal absorption and treatment outcomes. Number 8. Cephrelicast or Accolade. Alright, let's talk timing. If you're dealing with asthma and using Cephrelicast to manage it, you've got to pay attention to when you take your dose in relation to your meal. The trick is to aim for at least an hour before chowing down or waiting until about 2 hours after your meal to pop that pill. Why? Well, it's all about absorption. Taking Cephrelicast with food, especially a heavy meal, can slow down how your body absorbs it, which isn't ideal when you're trying to keep your asthma symptoms in check. By timing your doses right, you're ensuring that Cephrelicast gets into your system efficiently, ready to do its job in preventing and treating those pesky asthma symptoms. So next time you reach for your medication, remember the golden rule. Give it some space for your meals for the best results in managing your asthma effectively. Number 9. Proton pump inhibitors or PPIs. If you're battling gastroesophageal reflux disease or GERD with PPIs, timing is key. While most PPIs are best taken 30 to 60 minutes before meals, esomeprazole should be taken at least 1 hour before meals for optimal acid-blocking effects. Number 10. Methotrexate. Now let's talk about methotrexate. This medication is often used to manage autoimmune conditions like rheumatoid arthritis and psoriasis. For the best results, it's recommended to take methotrexate on an empty stomach, usually once a week. Try to stick to the same day each week for consistency. When you do take it, opt for a light meal or no meal at all. Heavy, high-fat meals can interfere with how your body absorbs the medication. Also, it's essential to limit alcohol intake while on methotrexate to avoid potential liver issues. By following these simple steps, you can help ensure that methotrexate effectively controls your autoimmune condition while minimizing any unwanted side effects. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Now that you're armed with knowledge about these medications, you might be wondering why empty stomachs are so crucial for their effectiveness. Here's the scoop. Slowed absorption. Food can delay the absorption of certain medications, causing them to take longer to work. Lower absorption. Some foods, drinks, and supplements can decrease the amount of medication absorbed by your body, reducing their effectiveness. Altered breakdown. Certain foods like grapefruit juice can alter how medications are broken down in your body, affecting their potency and potential side effects. So, what's the bottom line? Understanding when to take your medication on an empty stomach is essential for minimizing its effectiveness and ensuring you get the most out of your treatment regimen. If you're unsure about the timing or potential interactions of your medications, don't hesitate to consult your healthcare provider or pharmacist for guidance. In conclusion, while navigating the world of medication can feel overwhelming at times, knowing which medications to take on an empty stomach can make a significant difference in their efficacy. By following these guidelines and understanding the importance of timing, you'll be well equipped to manage your health with confidence. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!